A warm welcome to this video. Always good to talk. I've just done one of those rushed TV interviews, so it's much better that we're controlling the pace here. Now, in this video, I want to talk about the proportion of people that are asymptomatic and pre-symptomatic and how they can spread this infection. Now, the reason I started doing this was the Centre for Disease Control just today have announced that if someone has been exposed to someone who has tested positive for the virus, closer than 6 feet in more than 15 minutes, they don't necessarily need to get tested. Now that's very strange, so we need to kind of work out what's going on. But first of all, we need to go through the science. Now, if you don't want to watch this video, I'm going to give you the bottom line now. From large-scale studies, it's been shown that truly asymptomatic people that never get any symptoms, A of course means without, that in adults it's 15.6% are truly asymptomatic. They never get any symptoms. So just under 16% never get any symptoms. A smaller number than we had thought. We did think it was much more than that. In children it's 28% never get any symptoms. So they're the number of true asymptomatics, smaller than we had thought. But 49% of people that start off being asymptomatic go on to be symptomatic. In other words, they're not true asymptomatics, they are pre-symptomatics. So basically half of people that start off with no symptoms but are infectious, they have the virus, they then go on to develop symptoms. And it looks like these pre-symptomatics are now the main driver of the infection, and indeed have been all the way through the pandemic. Now, the other thing that's interesting is people that have no symptoms can still get physiological changes in their body. There can be changes in the x-rays and there can be changes in the blood. Now, quite what that means yet, we don't really know, but I'm going to report on the data that we do know. And the other thing that's now come out fairly loud and clear from these studies is that in people that are asymptomatic, in people that are pre-symptomatic, in the later stages of being pre-symptomatic, just before they get symptoms, and in the people in the first few days after symptoms, they all have the same viral load. So people without symptoms, people before they develop symptoms, and people with symptoms are all equally infectious. That's why we've got this pandemic. Because with the SARS coronavirus 1, 2002, 2003, people were only shedding the virus in large amounts when they were really quite sick. So they were easy to identify and isolate. So this is why we have the pandemic. 49% of people that are asymptomatic shedding the virus go on to be symptomatic. And the viral loads are the same. And it's been estimated that 44 to 48% of all infections, so again, getting on for all of half of the transmission in the world, has been caused by people that are pre-symptomatic. So there we go. About 16% of adults asymptomatic, 28% of children asymptomatic, but about half of people that are asymptomatic go on to be symptomatic, and almost half of the cases of transmission in this pandemic, in the past and into the future, are likely to be from people that are pre-symptomatic, which makes the Centre for Disease Control new changing guidelines on testing even more confusing. But that's the bottom line on this video. And as you can see, that's got very, very profound implications for where we go over the next few months, and explains really why we've got to where we are as well. So it explains an awful lot. And I'm just going to go through some of these studies. I'm not going to take too long over it. In the description, of course, I always put the link so you can click on it for yourself. So this first study is a meta-analysis. Now, a meta-analysis is where academics take many different studies and pool all the data. So this one, they pooled data from over 50,000 subjects, 41 studies. And that's what they found. Asymptomatics were 15.6% were genuinely asymptomatic. In other words, that means that 85% basically, of all people that get this infection will get some symptoms. Many, of course, will be mild, but they will get some symptoms. In children, the pooled data gave well over 1,000 children, 11 studies, and it found 28% were asymptomatic. which means that 70 to 73% will develop symptoms. Very often in children the symptoms are very mild, but if you look, they are there. So they are the overall numbers now we have for symptomatics and asymptomatics. And to be quite honest, these probably won't change that much because that's based on pretty big scale data. Nearly half of the patients with no symptoms at detection will develop symptoms later. So about half of the people that have no symptoms will go on to develop symptoms, but of course in the meantime they will be infectious. And just under 50% of asymptomatics go on to become symptomatic, that's what we've said. Asymptomatic COVID-19 patients could have abnormal laboratory and radiological manifestations, which could be used as a screening tool. Now let's look at what these are. Now remember, these are people with no symptoms at all, and yet these physiological and anatomical abnormalities have been identified by medical investigations. That is interesting. What does this mean for the longer term? At the moment, we don't really know. Hopefully not very much at all, but we don't really know. Now, this was computerized tomography, which is a sophisticated three-dimensional X-ray, as you probably know. Now, only 36 patients had those in 4 studies, but 63% had abnormalities in the CT. So some had this consolidation. It's what you call this ground glass appearance. Some had it in one lung, one or the other. Some had it in both lungs. But 63% of people that were asymptomatic did have this abnormal chest X-ray. Now, this is interesting. So the lungs weren't quite right in these people. So that infers to me that if they did try to go running or something like that, they would have a lower exercise tolerance. So the symptoms may emerge in the right circumstance. But people that were complaining of no symptoms, 63% did have this abnormality on CT. We don't know how accurate that is because not many CTs were performed. Now, 27% had a reduced white blood cell count, lowered numbers of white blood cells, particularly the lymphocytes, what we call a lymphopenia, a low number of lymphocytes. Remember, these lymphocytes are vital because these are the particular white blood cells that fight the infection. And the proportion had increased numbers of lymphocytes, but the study didn't say how many. So some people had increased numbers of lymphocytes, some people had decreased numbers of lymphocytes. But this is a useful screening tool because if we could do a simple blood sample and see if the lymphocytes were increased or the lymphocytes were decreased, it might give us some indication that there was some virus going on. 42.3% had increased lactate dehydrogenase. Now, don't worry what that is. That's just, it ends in ase, so you know it's an enzyme. Now, this enzyme basically is released when liver or kidney cells are damaged. So that indicates that a lot of people that are asymptomatic, there may be some virus, not exactly damaged, but abnormal physiology at least going on in the liver and possibly in the kidneys, 43%. And 11% had increased inflammatory markers indicating there was inflammation going on in the body, which is not surprising. So this blood test here, these blood tests here, these 3, could be particularly useful for screening. So primary care nurses and doctors could use those to indicate who might be at increased risk. But it also indicates there's physiological abnormalities going on, sometimes anatomical abnormalities going on, even without symptoms. Quite what that means for the future, we don't really know yet. Now, this is another study. Again, do look at the link. It's all there. Now, the aim of this study was to quantitatively describe SARS coronavirus 2 viral shedding in asymptomatic and symptomatic patients. In other words, we've got this group of people that have no symptoms. How much virus are they shedding? We've got these people that have symptoms. How much virus are they shedding? We've got these people that haven't got symptoms yet, but we know after we've finished the study we'll go on to develop symptoms, the pre-symptomatics. How much virus are they shedding? Now, not a huge study, 303 patients, but they were all isolated so they could collect pretty good data on it. And they found out that of the 110 people that were taken into quarantine, of the 300 people in this isolation centre, 303 people taken into isolation, 110 were asymptomatic at the time, And only 21 of that 110 went on to develop symptoms. Less than other studies are showing. But of course, it was not a randomised sample, so there could be some bias in the way that is presenting. Likely to be higher numbers than that go on to be symptomatic, as we mentioned, from the more reliable studies. But the reason I wanted to show you this study was particularly the difference in the viral loads. Oh, as well as that, time from detection of SARS coronavirus 2 to symptoms onset in pre-symptomatic people was longer than we thought, 15 days. It ranged from 30 to 20 days. So this means that people could be shedding some virus for up to 15 days, which does kind of explain why we've got a pandemic. Now, having said that, they shed most virus in the day, in the 48 hours before they become symptomatic. But still, we're not so sure about that. We just know they're shedding most virus immediately before they become symptomatic. So time from diagnosis to the first negative conversion was 17 days. In other words, people were testing positive for the virus for 17 days in people that were asymptomatic, and symptomatic people slightly longer. So long periods of time, 17 days or 19 days, when people were testing positive, therefore could at least theoretically shed the virus. And the thing is, the viral loads were the same. The asymptomatics, the pre-symptomatics, and the symptomatics all had the same viral load on quantitative virology when you tested it. Therefore, in theory, I've got the same chance of spreading the disease. Now, it's maybe not quite as simple as this, because, as I probably just demonstrated, people that are symptomatic might be coughing more. Therefore, they can shed the virus more when they're coughing. So that could be a factor. But, of course, it depends how loud you talk. Some people just talk loud and therefore shed more virus, don't they? So, meaning many individuals with SARS coronavirus 2 infection remain asymptomatic for a long period, but may be infectious. Longer period of time, 17 to 19 days. Viral load was similar to that in symptomatic patients. Isolation of infected persons should be performed regardless of symptoms, is the implication of that. Because we know the asymptomatics and the pre-symptomatics are definitely spreading this disease. This study here, just go through this one briefly. 94 patients with laboratory confirmed 19, highest viral load in the throat swabs at the time of symptom onset. So the highest viral load is the day before and the day after people start with symptoms, therefore that's when they are most infectious. But of course, the first day of symptoms, the symptoms could be fairly mild. Some people, the symptoms are mild all the way through, of course, but other people only become sicker on the second and third day. But they're most infectious the first day after symptoms and the day before they developed symptoms. Now, so the further infectivity peaked on or before symptom onset, as we've said. And the estimated that 44% of secondary cases were infected during the index cases pre-symptomatic phase. Right, in other words, 44% of people that catch this virus have caught it from people that are pre-symptomatic. Pre-symptomatics were the main single form of driver of this infection. 44%. Therefore, the implication, disease control measures should be adjusted to account for probable substantial pre-symptomatic transmission. Makes perfect sense. I think maybe just one more study in this section, and then we'll see how we go. Right, so the implications of silent transmission for the control of COVID-19 outbreaks. And this is from the Proceedings of the National Academy of Science in the United States. So they're looking at huge amounts of data here. They evaluated the contribution of pre-symptomatic and asymptomatic transmission. The majority of infections attributable to silent transmission were both pre-symptomatic and asymptomatic. In other words, most transmission, the majority of people that caught this virus caught it from someone that was either asymptomatic or pre-symptomatic. They caught it from people that did not feel ill. So most people that catch the virus from people that are not ill at the time they transmit that virus. And the implication they make here is symptomatic based isolation must be supplemented by rapid. Right, so symptomatic based isolation, they're saying, is not enough. If you just isolate people that are sick and symptomatic, you're going to miss an awful lot of people. So that must be supplemented by rapid contact tracing and testing that identifies asymptomatic and pre-symptomatic cases. So this is saying if you think that someone has been infected, then you need to trace them, you need to test them, and if necessary you need to isolate them. And of course we know this is track, test, isolate. This is a well-known dogma over the past few weeks, so it's a bit surprising that the Centre for Disease Control do seem to have changed their mind on that, which we'll come on to. But that's what that study is saying, and that's from the proceedings of the National Academy of Science just at the end of July, so fairly up to date. 17.9% of infections. So here the American proceedings of the National Academy of Science, if they assume that 17.9% of infections are asymptomatic, so it looks like their data is about the same as the meta-analysis we looked at the start. Then if that's the case, let's say 18% of people are asymptomatic, then pre-symptomatic transmission accounts for nearly half, 48% of transmission. Asymptomatic transmission, 3.4%. Add those two together and you get over 50% of people getting infected from other people that currently do not feel ill. Even immediate isolation of all symptomatic cases is insufficient to gain control because of the pre-symptomatics and the asymptomatics. So we urgently need to scale up the testing of suspected cases. Makes perfect sense. Urgently need to scale that up. Supplemented by rapid contact-based surveillance to identify exposed individuals prior to their infectious period. So if we know someone's got the virus and we know they could have infected someone else, they need to be isolated until they get a definitive negative diagnosis, because they're just entering. The people that have been infected are just entering their most infectious period. Their most infectious time period. So that's what that's saying. Now, I think I could do this in two, but I think I'll just carry on. You can always have a break in the middle of the video, because this is from the Centre for Disease Control. Overview of testing for SARS coronavirus 2 infection. This is just the new guidelines from the Centres for Disease Control just out. Now, consideration of COVID-19 diagnostic antigen testing for the presence of the virus. Mild symptoms of COVID-19, your healthcare provider may advise you to get a test. So it looks like you may well get a test, or you'd be advised to get a test if you have mild symptoms. If you get a positive test or don't get tested, self-isolate for 10 days, is what the US is saying. In the UK, we say 14. And they're saying at least 48 hours after the resolution of any fever. Now, in the UK, we want people to isolate for at least 7 days after the onset of symptoms. But here in the US, they're saying that you need to isolate at least 24 hours after the resolution of any fever. And that's without the use of fever-reducing medications. Now, if you've got a high fever, if your body temperature is high, and you take paracetamol, acetaminophen, ibuprofen, Tylenol, paracetamol, Panadol, all these are different names for fever-reducing drugs. The acetaminophen and the paracetamol, that's the Tylenol, and the Panadol are actually the same. The ibuprofen is a different group called non-steroidal anti-inflammatory drugs. But anyway, all of those will reduce your fever artificially. So anyone can have a normal temperature if they take those drugs. But this is saying you need to have no fever for 24 hours without taking those. In other words, it means you've got better, because they'll just mask the symptoms. And in my view, taking fever-reducing medication reduces the efficiency of the immune system. So far so good from the Centres for Disease Control there. Yeah, mild symptoms, may want to test. I would say put it stronger than that. But of course, whether they get tested or not is not too pivotal as long as they obey the 10 days and the 24 hours according to the American guidelines. Self-isolating for 10 days after symptom onset and for at least 24 hours after the resolution of fever. Now, this is the bit that is positively weird. Positively weird. I don't understand the Centres for Disease Control thinking here at all. If you've been in close contact, that's within 6 feet to 2 meters of a person with COVID-19 infection for at least 15 minutes, but you don't have symptoms yourself. Now, let me just ask you, if you had been within 6 feet of a person with COVID-19 who was shedding the virus, and you've been in that close contact for at least 15 minutes, do you think there's a reasonable chance you will have contracted the disease? It's not a trick question. I mean, you all know the answer to that. Of course there's a good chance you'll have got the disease. Of course. Of course, therefore you would need to self-isolate, of course. Get tested, of course. But the Centres for Disease Control have changed their guidelines, and they say you don't necessarily need a test unless you're in a vulnerable group. Now, they're not saying you refuse you a test, they're saying you don't necessarily need one. You can have one if your healthcare provider or state or local public health officials recommend you to take one. So you can have one if your doctor or your nurse tells you to take one, or the local protocols is you take one. But it's really quite surprising. You don't necessarily need a test unless you're in a vulnerable group. But of course, you are probably, under this circumstance, you are probably going to be infected, therefore soon infectious, to infect other people. And they rightly say a negative test does not mean you will not develop an infection from a close contact or contract an infection at some later time. So they're right here in saying that you could be exposed to the virus one day, test negative the next day, but then go on and test the virus in a few days, test positive for the virus in a few days' time, because it takes time for the viral numbers to build up in the respiratory tract, because we know people can be asymptomatic, or people can be developing this illness for the incubation period between 2 and 14 days incubation. So is that what they're thinking? I'm not really sure. But it's certainly a big change. It doesn't really make a lot of sense. But they do say you should monitor yourself for symptoms. So there you go. People that are almost certain to have caught the infection now do not necessarily need a test. Go figure. I don't really get it. If you have COVID-19 symptoms but have not been close to a contact or someone you know, okay, fair enough, you don't need a test. So if you've no symptoms, you haven't come into contact with it, I would agree you wouldn't need a test. Now, this one also a bit strange, to be quite honest. If you're in a high COVID-19 transmission area and have attended a public or private gathering with more than 10 people without widespread mask wearing or physical distances, again, to me, good chance you've got it. Good chance you've got it. Maybe not as high as being in close contact at less than 6 feet for more than 15 minutes, but still a reasonable chance. But still, the CDC say you do not necessarily need a test. Now, if you live or work in a care facility, of course you need a test. And if you work as a critical worker or healthcare worker, of course you need a test. So I see quite a significant inconsistency between the data that we looked at in the science and those recommendations from the Centre for Disease Control. I don't understand their thinking. Now, the only thing I can think they may be thinking is if we look at the cases in the United States, so thankfully we see that the cases are reducing quite significantly, which of course is good. So cases are reducing. Still a lot of new cases though. We're still on what? Over 40,000 a day. This hasn't gone away by any means. Not by any means. And the death rates, although they've dropped off substantially, I mean, these death rates are still significant. We're still talking 1,000 deaths a day, even though it has dropped off quite substantially. So are they thinking that, I don't know, are they thinking it's going away? Are they thinking that because deaths are much lower, we don't need to bother testing now? Or are they abandoning trace, test, isolate? Well, they're certainly not abandoning and isolate. They're recommending that. So it looks like the policy's kind of changed to trace and isolate rather than trace, test, isolate. Anyway, let's just look at one piece of reaction to this. New York Times. Now, I'm still working out American newspapers. I don't know quite what's reliable and what's not and what has left-leaning and right-leaning. But I don't care. I'm just going to adjudicate it on what it says. That's the headline. Now, Centre for Disease Control and Prevention, the New York Times say they've done this quietly. Well, they haven't done it quietly. It's on a public website, so that's ridiculous. They say they've moved to exclude people who do not have symptoms. Well, they're not excluded. We've just seen that they can be tested by their healthcare providers. They're not excluded. So a bit of journalistic, let's be kind. What's the kind word? A bit of journalistic license there. Other people might use stronger words to indicate negative implications. Even if they've been currently exposed to the virus. So they're not saying it's not done quietly. It's not done to exclude them. They're just saying that the healthcare provider, they don't necessarily need a test. But people have been commenting on this. This is potentially dangerous. It's certainly a big change. I would agree with that. Restricting testing to only people with obvious symptoms is not a good idea. I don't think that should be restricted. You're not looking for a lot of people who are potential spreaders of the disease. Now, these ones in italics are direct quotes from these people above. So I don't quite know what she means there, actually. You're not looking for a lot of people who are potential spreaders of the disease. Well, I would have thought you are looking for quite a lot of people, so I think that's probably just bad grammar. I feel this is going to make things worse. Well, I would agree with that. So, of course, the New York Times are bringing out people that are likely to agree with their view, but I think we do basically agree with it. Daniel here is saying, I think it's bizarre. Any move right now to reduce levels of testing by changing guidelines is a step in the wrong direction. I would agree. Prior iterations of the Centre for Disease Control testing guidelines have been perfectly logical and consistent with the data. In the past, they've said testing is recommended for all close contacts of people infected with coronavirus, regardless of symptoms. That's what they've said in the past. It's a fair old change of tune, isn't it? The potential for asymptomatic and pre-symptomatic transmission is there, of course, as we've proved now, or as good as we can with this epidemiological data. And this is an important factor in preventing the spread of the virus. So there we go. Sorry that was a bit long. But we've presented definitive data now showing how many people are asymptomatic, but showing that the vast majority, or the majority rather, of transmission is from people that are pre-symptomatic. And when you combine the transmission from pre-symptomatics and asymptomatic, that's over 50% of people that have caught this virus have caught it that way. So in the light of that, it's somewhat surprising that the Centre for Disease Control is saying that if you've been in close contact with someone less than 6 feet for more than 15 minutes, you don't necessarily need tested. I'm really struggling with this. I mean, why? Are they short of tests or something? Is there so many cases they haven't got enough tests to go around? I really don't know, but it does seem surprising. But that is where we are at. But let's take positives away from this. We don't want to leave it with questions. We know that most people are spreading the virus in the pre-symptomatic phase. So if you've been in contact with someone who is potentially infectious, or you've been in areas where good preventative measures have not been taken, then to be safe you need to self-isolate for the American recommendations 10 days, the UK recommendations 14 days. Otherwise you will be spreading this virus on. And of course, if you can't get tested, then you'd have to stay in isolation by the American guidelines, the US guidelines, for the full 10 days. because you can't get tested. Whereas if you could prove that you were negative, then you could be released from isolation earlier. Although having said that, the Centre for Disease Control is at pains to say that even if you test negative now, you may test positive later. So that's maybe the crux of this guidelines, and I expect they will be explaining this. Perhaps what they're thinking is if someone gets a negative test, then they would leave self-isolation, but they could test positive the day after. Maybe that's what their thinking is. It's a pity they didn't explain that. I've just kind of worked that out as I was talking to you about this actually. That could be their thinking. So it's possible that you could be exposed less than 6 feet, more than 15 minutes, be exposed, a couple of days later go for a test negative. Day after that, you could be back at work because you tested negative and be happily spreading the virus around. Now, if that's the Centre for Disease Control's thinking, that means that people like this, reported by the New York Times, might not quite have got the gist of what's going on. So it could be that they are trying, it could be that the Centre for Disease Control is trying to overt or negate the false sense of security that could be generated by false negatives. That could be what it is. Let's hope they clarify over the next few days. Interesting story. If you know something I don't, do let me know. If you stuck with this video all the way through listening to all these ramblings on, but this is kind of the way that your brain works to try and work out what's going on, and that could be what's going on. But regardless of that speculation, I hope you've learnt a bit of definitive science from this video that will inform us into the future for the next, well, into 2021.